But how's things up your way, indicator?
It's good. We let it thaw out because we didn't want to put people at risk trying to drive in on the ice, and that's just not a good combination. So.
Everyone's like, you guys drive a Hummer. Yeah, but we don't want to have to go pick up everyone get them here safely. So, and that's always good that you own a business, you're able to do that, and you have to be considerate. And you don't want patients coming in either.
Right. Well, I've got staff that have to drive down big mountains and stuff, and I want them to be home safely with their family, so it's just a smart thing to do.
Yeah, kids are out of school. But one thing everybody needs to do that we don't talk a lot about is protect our eyes. Why is that? I mean, we only have 2 eyes, and it should be one of the most important things people want to take care of.
It's just one of those things like everything else we take for granted until something happens. And so, and that's where we kind of specialize, is trying to look for things ahead of time and just be proactive, whether it's just making sure you have the right eye protection when you're using your computer versus your activities versus protecting your eyes against certain diseases.
What exactly can you find out when you talk about certain diseases just by looking into our eyes?
High blood pressure, diabetes are the 2 big ones. Anything systemic, we can have issues there. We've actually, based on the patient's complaint come in, we've actually determined that they probably have a brain tumor or something going on, and so that's a life-saving diagnosis.
I didn't even know high blood pressure, you can tell.
We can.
What does diabetes look like?
In the back of the eye, there's just a lot of little bleeding spots back there, and so we don't see it as much as we used to because most people are getting care, but early in my career, I was the first to diagnose it in a lot of patients because they didn't know their symptoms were due to elevated blood sugar, and so they would come in and their vision wasn't as good, and I would look back there and I would see the signs of diabetes.
It's kind of hard to tell someone, isn't it?
It is. It's and they don't realize it because they don't put it together, but once they go to their doctor and they get confirmation, then they're very grateful that we found it.
Yes, that would be a big help. All right, we talked about children getting eye exams, and nobody ever thinks to take a 3 or 4-year-old to get an eye exam.
They don't. And we had a little boy came in last year. He was 4 years old, had been to a doctor in Atlanta, and for whatever reason, they did not detect that he had been born with a cataract in one eye. They just thought he had a lazy eye, and so they were trying to do us therapy. So I saw him yesterday. He had come in, and he had his cataract off, and so now his vision is starting to improve, and so we just got to get him in some therapy and get him to see him better. So
that's awesome. All right, let's talk about dry eye, because I know everybody says, oh, I just have allergies. My eyes are scratchy, they itch, they burn, It's the allergies.
Right.
It's the pollen.
It's the pollen. Where's the pollen right now at 9 degrees, right? Well, I asked the question. They said, well, it's probably just my allergies. I said, well, are your eyes itching? And they go, no, they're not itching. I said, well, it can't be allergies because the #1 symptom of allergy is itching.
Itchy eyes.
Itchy eyes. So sometimes if you do have dry eye, it will make you more susceptible to develop allergies, but it may not be the root cause.
Okay.
And so, as we've talked about before, a lot of the over-counter drops are not necessarily suited to treat that. It's just going to be kind of like a Band-Aid, and you really need to use the right drop. So it's important to get a good diagnosis, and then we can get you on a treatment plan to help with that.
Nothing would be worse than going to the store, picking out those eye drops, and then there you are. You've used them every day, and then you go back to no, they're not. You go back to the eye doctor, and they're like, those didn't do a bit of good.
And they know that. They figured out before they come in here. And so they use all these drops and say, well, there's nothing I can do. I'm just going to have to live with it. But there are things that we can do to help that.
And you're not talking about just the eye drops to just add tears.
Right.
There's different kind of drops out there.
Right. And there's most people do have a lipid deficiency. We don't produce enough oils. And so there are certain drops that will help. But there are certain treatments that we can do to actually diagnose and treat that. We can actually show them what their oil glands look like. We can show how they're working. A lot of people are partial blinkers because of all the computer use. So that definitely
I always want to blink
that.
when you say that.
I know. Everybody starts blinking because that's not something we normally think about.
Right.
And so people are shocked when we show them their video and they go, hey, my eyes aren't closing. I go, I know. That's why you're having your problems.
So people need to, if you're working at a computer, you always say 20 on, 20 off? Or iPad if you can?
Well, iPad if you can, but you can't really do that for work because you get fired. But at least,
but Doc told me to do it.
But 2 to 3 minutes, if you can, just to kind of take a break, look at a distance, close your eyes, squeeze them together, open, repeat that a few times. About every 30 minutes to an hour or so, try to at least get a little bit of a break in.
I want to talk about now what I would think if I had to wear glasses. My favorite thing. You can make some people not have to ever wear glasses again.
Right. That's really cool.
That is.
The Gentle Molding or Paragon CRT, it's Ortho-K if people want to look it up online. But it fits them with lenses that reshapes their eyes so they don't have to wear glasses or contacts during the daytime.
Nice. And it works for a fact. You did it on yourself.
I've been doing it on myself for almost 4 years now.
All right.
My son did it for 11, 12, so he's been doing it as well too.
Right. So some people have worn glasses their whole lives. They just come in to see if they're a candidate.
Right, and some people want, they think they want surgery, but they don't want surgery because who
Right.
wants their
Who
eyes
wants
cut
surgery?
on? And so this is a reversible way to correct your vision so that you don't have to be dependent on glasses or contacts.
You're not
during
talking
the
about
daytime.
LASIK, anything like that. You're actually sleeping with a contact in your eyes.
Right, so you
A
only
harder
wear it
contact, so
seven
it's
to 8
not
hours
bad.
at night, so while you're sleeping, you sleep fine. A couple of days to get used to the lens in there, but most people don't have any issues with it, and once you get used to it, you do great.
And actually affordable.
Yes, it is.
You have to buy glasses every year or
Yeah.
change your prescription. I mean, that
Right.
adds up over
It
the
does.
years.
It
So
really does.
good. All right. Where are you located?
In Decatur, Alabama, or about 15 minutes down 31.
That's right. You can't miss them. Look for
That's
those
right.
crepe myrtles and that big blue sign.
I know. That's right.
823 6th Avenue. Personally guaranteed that you're going to have a great time when you walk in there, too. And the
right.
staff is wonderful. Mary and Beth are all
Yeah.
super when you walk
I
in.
told Miss Betty Roberts hello this morning. I told her I would. She told me to say something to her. So
Good
I didn't bring my
morning,
vine
Miss-
of sausage this morning. But,
But we're
trying.
sending some home with your name on it,
That's right.
just for you, Miss Betty.
give me an autograph.
That's right. All right. Well, if you have any questions, you can give me a call, ask me about it too. I'll be happy to share our experience when we went down to Innovative Eye Care, and it was wonderful. Call and make those appointments, especially if you have not had your exam once a year. That's all you have to do, once a year, to get those eyes and keep them good. They're the only eyes you have. All right. We're going to take a quick break. Thank you, Dr. Teichmiller. All right. Jackson. We're going to talk to Jackson Heating and Cooling, Plumbing, and Reggie Jackson. We got so many Jacksons in here this morning. Stay with us. We'll be right back.